Hi all, today we are going to discuss about aseptic techniques. Okay, so this is an important topic for pharmacy technician exam. So aseptic techniques are strict procedures that healthcare providers use to prevent the spread of infection. So aseptic technique, it is a set of specific practices and procedures that is used for preventing the contamination by pathogens during the medical or laboratory procedures. So mainly they prevent the spread of infection. So these procedures involve following rigorous guidelines to ensure the environment remains free of pathogens. So in order to ensure the environment that is for the medical or laboratory procedures are free from pathogens. So this is techniques. So when we use this correctly, aseptic techniques can help to stop the patients from experiencing any of the preventable adverse effect associated with parenteral therapy. So the main goal of aseptic technique is to maintain sterile environment to avoid infection and ensure patient safety. So it include hand hygiene, use of sterile equipments, protective barriers like using PPE, that is personal protective equipment, and environmental controls like ensuring the area where the procedure takes place is clean according to the protocol. This all is coming under the aseptic techniques. Okay, so in 2004, the United States Pharmacopoeia, that is USP, officially released Chapter 797, which is having the detailed standards for the proper preparation, storage, and transport of sterile medication. So all the details, all the standards related to the sterile medications are included in USP chapter 797. Okay, so here USP chapter 795, it include all the details about non-sterile preparation, and USP 797 chapter, it is having all the details that is related to sterile preparation. That means preparation, handling, storage, everything is included in this USP chapter 797. And about the hazardous handling of hazardous drug, proper storage, transportation of hazardous is included in USP chapter 800. So this one is important, the USP chapters and what does it include. Okay, that is important. Next is about the International Organization for Standardization, ISO. ISO refers to the classification of clean room environments based on the cleanliness of the air in terms of particulate contamination. So it is mainly the classification of cleanliness of the environment. So 146441, it is classified into 9, class 1 to class 9. Class 1 is the cleanest room and class 9 is the least clean room. Okay, so ISO class 1, the maximum particles is 0.1 micrometer and it is mainly used where the highest level of cleanliness is required. Okay, so it is used in sensitive environments like semiconductor manufacturing where it is requiring highest level of cleanliness. And ISO class 2, it is including maximum particle size, that is 10 particles per cubic meter, and it is also used in semiconductor and pharmaceutical industries. And ISO class 3, it includes 1 or 2 particles per cubic meter and it is suitable for environments where minor contamination could impact product quality. So if there is any minor contamination that will affect the product quality, for such preparation we are using ISO class 3. And ISO class 4, it is common in industries like biotechnology and pharmaceuticals. And ISO class 5, this is important. ISO class 5 means it is the standard for sterile environment, widely used in clean rooms and labs. So it is the standard for sterile environment, ISO class 5. And ISO class 6, it is suitable for certain manufacturing process laboratories. And ISO class 7, it is also important. It is often used in pharmaceutical packaging and similar applications. ISO class 8 is suitable for areas where minimal contamination control is needed. And last one, ISO class 9, it is the lowest cleanliness. It is used where the lowest cleanliness is required, often used in less sensitive manufacturing areas. So ISO class 9 is the least clean room. So this is about the 9 ISOs, ISO 1 to ISO 9. ISO 1 is the highest clean room, most clean room, and ISO 9 is the least clean room. So among these, ISO 5, 7 and 8 is important. Okay, so we can discuss where this ISO 5, 7, 8 is used. Okay, this one. So sterile compounding clean room. First one is primary engineering control, that is PEC. PEC means it is the important piece of equipment for sterile compounding process. So important piece of equipment that is used for the sterile preparation is called primary engineering control, and the most commonly used PEC is laminar airflow workstations. Okay, so laminar airflow workstations are the important piece of equipment most commonly used for the sterile compounding. So inside laminar airflow workstation, the ISO that is used is ISO 5. So inside the PEC or inside the laminar airflow workstation, air quality is ISO class 5. Okay. And secondary engineering control, that is SEC. It is the room that contain PEC. So the room that contain primary engineering control or the room that contain the laminar airflow workstation, it is called secondary engineering control, or it is also called buffer room. Okay. So inside the buffer room, the ISO is ISO class 7. So inside the laminar airflow workstation, it is ISO 5. Inside the buffer room, the air quality is ISO 7. And third one is all space that is connecting the buffer room and outside the environment. So this is the outside environment that is connected with this buffer room, a small area that it is ISO 7 or 8. Okay, so these three places, what is the ISO? That is important. So inside the laminar airflow workstation, it is ISO secondary engineering control, it is ISO 7, and in the anti-room, it is ISO 7 or 8. Okay, so this one is very, very important. Next is the standard 209 and ISO 146441. Federal standard 209 is the earlier method for the classification. So comparison, ISO 3 is FS1, ISO 4 is FS10, ISO 5 is FS100, ISO 6 is FS1000, ISO 7 is FS 10,000 and ISO 8 is FS 1 lakh. Okay, so the questions will be ISO 5 means and the options will be 1,000 and 1 lakh. So ISO 5 means it is 100. So it is starting from ISO 3. ISO 3 means 1 and 4, 5, 6 you can add zeros. Okay, so ISO comparison, ISO with FS comparison, this one is also important. And next one about PEC. The most important piece of equipment for the sterile compounding process is called primary engineering control. And in USB chapter 797, the sterile products preparation, for the preparation of sterile products, they are using ISO class 5. So inside the primary engineering control, it is used. That ISO class 5 is used. And laminar airflow workstation are common types of primary engineering control that can create ISO class 5 environment for non-hazardous and sterile compounding. So laminar airflow workstations are the common type of primary engineering control that is having ISO class 5. And high efficiency particulate air filters, that is HEPA filters, it is used in the laminar airflow workstation. So when air is forced through the filters in a uniform fashion, 99.97% of all air particles, 0.3 micrometers or larger, are removed. So when the air is passing through the HEPA filters, the air is getting purified. That is almost 99.97% of all air particles are removed when the air is forced to the HEPA filters. So the air can get purified by passing through the HEPA filters. And we are having two different types of laminar airflow workstations, that is vertical laminar airflow workstations and horizontal laminar airflow workstations. So in vertical laminar airflow workstations, HEPA filtered air emerges from the top of the hood and passes downwards through the work area. So it is moving vertical direction. That means from top to bottom the air is emerging. Okay. So because exposure to hazardous drugs may be harmful for the compounder, They should only be prepared in vertical laminar airflow workstations to minimize the risk of exposure to airborne drug particles. So for the hazardous drug, when preparing, it can get contact, it can get exposed to the compounder who is preparing the hazardous drug. So it can cause many health issues. So while preparing the hazardous drugs, these hazardous drugs are prepared by using vertical laminar airflow workstation. In vertical laminar airflow workstation, the air is passing from top to bottom and it is not coming in contact with the compounder. So it is safe to prepare hazardous drug in vertical laminar airflow workstations. So the type of vertical laminar airflow workstation used for the preparation of hazardous drug can find airflow within the hood and are referred to as biological safety cabinet. So it is the air is confined in the workstation only. Okay, within the hood the air is confined, so it is not coming in contact with the compounder. So it is safe to prepare the hazardous drug in vertical laminar airflow workstation. So for preparation of hazardous drug, you should always use vertical laminar airflow workstations. And in case of horizontal flow hood, horizontal laminar airflow workstations takes up air and channel it through the HEPA filters. The air crosses the work area in the horizontal direction. Okay, so the air passage is in horizontal direction, that is towards the compounder. Okay, so in pharmacy, the most widely used sterile compounding hood is horizontal laminar airflow workstations, and it is most commonly used for preparing non-hazardous sterile products. So for preparing non-hazardous sterile products, we can use horizontal laminar airflow workstations, and for preparing hazardous drug, we can use vertical laminar airflow workstation. So these 2 points are very important. Next is general principles for operating laminar airflow workstations properly. And this laminar airflow workstation, that should be positioned away from the doors or air vents. It should not be placed near to the doors. It should be positioned away from the doors and air vents, and it should not be turned off. Never turn off the laminar airflow workstation. It should be always in on. Okay, if the power shutdown, if in any case the power shutdown in the laminar airflow workstation, the air will be non-filtered, non-sterile. Okay, so the if any power shutdown is there, there will be non-filtered, non-sterile air that will occupy in the laminar airflow workstation work area. So when the power is returned, you should turn on the laminar airflow workstation for minimum 30 minutes before the use. Okay, so turn on the laminar airflow workstation if the power is returned for minimum 30 minutes. That will purify the air, that will filter the air, and that will make the air sterile. Okay, so if in any case the laminar airflow workstation is turned off, when the power return, it should be on for minimum 30 minutes before the use. Okay, only after that you can start preparing in the workstation. Okay, and nothing should be permitted to come in contact with HEPA filters, that include cleaning solution. While cleaning solution or while preparing any drug spray or glasses from ampules, nothing should be coming in contact with the HEPA filters. And the laminar airflow workstation should be tested by qualified personnel every 6 months. Okay, in a year, 2 times it should be properly inspected. And the most common cleaning agent used within the pharmacy on laminar flow hood is isopropyl alcohol 70%. It is used as the cleaning agent for cleaning the laminar airflow workstations. And the correct way to clean the laminar airflow workstation is from top to bottom on sides, then back to front using side to side motion. That should be away from HEPA filters by using isopropyl alcohol 70%. Okay, so top to bottom and back to front pattern should be followed for the cleaning of laminar airflow workstation with isopropyl alcohol 70%. Okay, and next is about the buffer room. Buffer is the secondary engineering control. That is the room where primary engineering control is located and aseptic compounding take place. It should always have ISO class 7 environment. And other term is beyond use date. Beyond use date is the date after which a compounded sterile preparation should no longer be stored or transported to the patient. So the sterile compounded product or the compounded sterile product, after a specific time or after a specific date, it should not be stored or it should not be transported to the patient. So that date is called beyond use date. So date or time after which the compounded medication should not be used as its safety, efficacy, or sterility cannot be guaranteed. Okay, so for non-sterile formulation, the beyond use date is 6 months. So for sterile preparation, the date may varies. Okay, so after that date, it should not be used. So next is about the beyond use date. The drug is classified into immediate use compounds, low risk compounds, medium risk compounds, and high risk. So immediate use compounds that are the usually made outside the pharmacy without any safeguard and are only for life-threatening situations and medical emergencies. So it is prepared outside the pharmacy at the time of any emergency or life-threatening situation or during any surgery procedures in the emergency conditions. This prepared outside the pharmacy. So it should be compounded for the immediate use. Okay, in the emergency condition, it should be prepared for an immediate use, and it should be used within 1 hour. Within 1 hour, it should be used because it is prepared outside the pharmacy. So it is having more risk of contamination, getting contaminated. So it should be used within 1 hour, and it should be intended for the single patient use. Only for single patient it should be used, and leftover should be discarded immediately after the use. So you should not store the leftover products. It should be discarded immediately after the use. Okay, so this is about immediate use compounds. So the beyond use date is within 1 hour it should be used. And low risk compounds that are made in ISO class 5 environment with no more than 3 products. No more than 3 products are used for the preparing of low risk products. And low risk products are having beyond use date of 48 hours at room temperature, 14 days in refrigerator, and 45 days in freezer. Okay. So compounding involves 1 or 2 sterile ingredients or simple transfer of sterile solution from one container to another for dilution or reconstitution, or are the examples of low risk compounds. Next is medium compounds that are made with more than 3 products. So more than 3 products are used for preparing medium risk compounds, and beyond use date is 30 hours at room temperature, 9 days in refrigerator, and 45 days when frozen. And high risk compounds that are made from non-sterile ingredients, they are having more risk of for getting contaminated. So the beyond use date is only 24 hours. That is 1 day at room temperature, 3 days in refrigerator, and 45 days when frozen. Okay, so these are the beyond use date of compounds. Next is personal protective equipment, that is PPE. It is gowning worn to protect a compounder from hazardous materials or to prevent shedding of human particles. So mainly this PPE kit include a pair of shoe covers, hair and face covers, an impermeable gown, pair of chemotherapy rated gloves, and respirator mask. So these are the contents of PPE kit. So the order of gowning the PPE is given here. This one is important. The order is asking for the exam. So the steps for proper gowning before undertaking sterile compounding is: first, you have to place the shoe covers over the footwear. Over the footwear, you have to use the shoe covers. After that, cover all the exposed hair with a hairnet. Okay. And third one is place fitted face mask over mouth and nose. Men with facial hair should also don a beard cover. Okay, so first one is shoe cover, second is hairnet, third is face mask, and fourth is perform hand hygiene. Hands and forearms should be vigorously scrubbed for 30 seconds with an antimicrobial soap. And fifth one is don a non-shedding arm length outer gown. So after that, you have to wear the gown, powder free, sterile gloves. So last one is wearing gloves in the buffer room. Gloves is weared in the buffer room. The cuffs of the gloves should be on the arm as far as possible. So the cuff of the glove should be always outside the gown. Okay. And the gloves is wear or is placed in the buffer room. And gowns are the only type of PPE that can be reused only for the non-hazardous compounding. So for non-hazardous compounding, the gown, other things should be discarded. So the proper method of gowning the PPE is important with them. So contact with this drug can cause immediate problems like dermatitis, dizziness, nausea, and headache. And when it is repeated or long-term exposure to small amounts can cause organ damage, chromosome damage, impaired fertility, or even it can cause cancer. So hazardous drugs are categorized into three categories based on the National Institute for Occupational Safety and Health, that is category 1, 2, and 3. So category 1 include anti-neoplastic drug known to be hazardous with repeated exposure. So anti-cancer drugs, most of the anti-cancer drugs hazardous, hazardous with repeated exposure. So it is category 1. And category 2 means it is non-anti-neoplastic drug that is hazardous, that comes under category 2. And category 3, it includes medication with adverse effect on on reproduction. So if any drug is having adverse effect on reproduction, it is included in category 3. So hazardous drug category requires special handling. As it is hazardous, it is requiring special handling procedures to minimize the potential for accidental exposure. And USP chapter 800 explain the special procedures including receiving, preparation, labeling, storage, and transportation of the hazardous materials. Okay. Next is about large volume parenterals. Large volume parenterals are the intravenous solutions packed in containers holding 100 ml or more. So 100 ml or more content will be there in large volume parenterals. So some common used large volume parenterals, some common uses of large volume parenteral solutions without additives include correction of electrolyte. So for electrolyte correction, fluid balance disturbances, in order to correct the fluid balance disturbances and nutritions and vehicles for administering other drugs. These are the common uses of large volume parenterals, and the common sizes of large volume parenterals are 100 ml, 250 ml, 500 ml, and 1000 ml. These are the common sizes of LVP. And some common LVP solutions are sodium chloride solution, dextrose solution, ringer solution, and lactated ringer solution. So various combination of different strength is also available. For example, 5% dextrose and 0.45% sodium chloride combination is available, or 5% dextrose plus 0.225% sodium chloride combination is also available. So combination of different strength of sodium chloride and dextrose solutions are also available as the large volume parenteral solution. Next is small volume parenteral, SVP, are the solutions that are packed products that are either directly administered to a patient or added to another parenteral formulation. So it is directly administered or it is added to another parenteral formulations, and it holds around 50 to 250 ml. So 50 ml is the most common size, and 50 to 250 ml is the size that is available for the small volume parenterals. So small volume parenteral solutions are supplied in pre-filled syringes, ampules, glasses, or plastic vials that is sealed with a rubber closure or plastic mini bags. So it is a pre-filled drug or packed products, and most often small volume parenteral is put into a mini bag and used as a piggyback on large volume parenteral. So the large volume in the large volume parenterals, small volume parenterals are usually given as the IV piggyback that is administered together with the large volume parenterals. Next is about the duties of pharmacy technicians. So pharmacy technicians can take informations from the patients. It is involved in the inventory control for checking proper stock of the medicines in the pharmacy. It is a responsibility of pharmacy technician. And pharmacy technicians can receive the prescriptions, they can fill the prescriptions, they can compound the medicines, they can order the medicines, and they can work with a team of healthcare professionals. Combined working is also in the case of pharmacy technicians. So these are the role of duties of pharmacy technicians, and they can prepare medications, they can fill the patient medication cart, they can restock the automated medication dispensing devices, they can deliver the medications to nursing units that include chemotherapy and controlled substances. They can prepare extemporaneous compounding. They can involve in the extemporaneous preparation or compounding, and they can perform the functions related to quality control and quality improvement. They can pull the expired or recalled medications. They can do billing and miscellaneous paperwork. They can fill missing those requests. So these are the duties of pharmacy technicians. And finally, it is about the centralized pharmacy services and decentralized pharmacy services. So centralized pharmacy services refer to a system in which all pharmaceutical services are managed from a single location within a healthcare facility. So if all the pharmaceutical services are managed from a single location, it is called a centralized pharmacy services. So this model is commonly used in hospitals and large healthcare. Decentralized pharmacy services means in which pharmacy services are integrated into various departments. Various departmental pharmacies will be there, like oncology department, endocrinology department, and emergency department. The pharmacy will be either in separate department. Okay, so it is integrated into various departments or units within a healthcare facility rather than being managed solely from central location. So that is decentralized pharmacy services. This approach enhances the role of pharmacists in direct patient care and promote collaboration with other healthcare providers. So there will be direct contact with the patient. The pharmacist in each department will be having direct contact with the patients, and they can involve in the direct patient care, and they can have the work collaborated with other pharmacists, other healthcare providers. So this is about decentralized pharmacy services. So this is about this chapter, aseptic techniques. So in this portion, this one is an important chapter for the pharmacy technicians. So please go through all the portions thoroughly. Okay, thank you.